What are the risks of taking too much vitamin E? Vitamin E is essential for good health, but can too much be a bad thing? Some studies suggest high doses might be harmful, so it's crucial to understand safe dosages and potential risks before you consider supplementing. This video will break down everything you need to know about vitamin E supplementation. In this video, we're going to dive into the potential risks of taking too much vitamin E. While this essential nutrient is known for its antioxidant properties and benefits for your immune system and blood circulation, excessive intake can lead to some serious health concerns. We'll break down the risks, including how high doses may affect your blood, increase the risk of certain cancers, and even impact your lifespan. Plus, we'll cover the safe dosages and how to ensure you're getting enough vitamin E without overdoing it. Stick around as we explore everything you need to know before considering a vitamin E supplement. Before we dive into the dangers of excessive vitamin E, let's clarify what this vitamin actually does in your body. Vitamin E is a powerful antioxidant, protecting your cells from damage. But its benefits go beyond that. It also boosts your immune system and even helps prevent blood clots. Interestingly, vitamin E isn't just one thing. It's actually a group of 8 different compounds. Our bodies primarily use one of these, called alpha-tocopherol. So when you see vitamin E on a supplement label, it's usually referring to this specific compound. Your body can't produce vitamin E on its own, so you have to get it from the foods you eat. Once you consume vitamin E, your liver handles the bulk of the work, breaking down over 70% of it. Your kidneys and intestines also play smaller roles in processing vitamin E. Getting vitamin E from food is generally safe. There's no evidence that eating vitamin E-rich foods will cause you harm. However, the same can't always be said for high-dose vitamin E supplements. Taking too much in supplement form can carry some risks, and we're going to explore those in detail right now. 1. Abnormal bleeding and strokes. Vitamin E plays a role in blood clot prevention, working by interacting with vitamin K. Vitamin K is essential for producing blood clotting proteins. So, it makes sense that too much vitamin E could potentially increase your risk of bleeding. Here's why. Animal studies have actually shown this connection. When rats were given very high doses of vitamin E, they were more prone to bleeding. Interestingly, giving them vitamin K seemed to counteract this effect. Human studies have primarily investigated whether excessive vitamin E intake increases the risk of hemorrhagic stroke, a stroke caused by bleeding in the brain. However, the findings have been somewhat inconsistent. One review analyzing multiple studies did suggest a slightly increased risk of hemorrhagic stroke with high vitamin E intake. It's important to note that this increased risk was small, and not all studies showed this link. Even more interesting, the results seem to differ between men and women. However, this difference could simply be due to variations in the vitamin E dosages used in the different studies. Let's look at some specific studies. One large study focusing on men taking a high dose of 800 mg of vitamin E every other day found a concerning result. They were more likely to die from hemorrhagic stroke. However, another study looked at women taking a lower dose of 400 mg of vitamin E every other day. This study found no difference in stroke rates. Even more interesting, a much larger study involving over 9,000 men and women taking a daily dose of 180 mg of vitamin E also found no increased risk of stroke. So, what can we conclude from all this? Looking at the largest study conducted so far, there's currently no strong evidence suggesting that vitamin E supplementation increases the risk of bleeding-related strokes. 2. Prostate cancer. Beyond stroke risk, researchers have also explored the connection between high vitamin E intake and prostate cancer. So far, the results have been inconclusive and somewhat conflicting. Initially, there was a belief that vitamin E might actually protect against prostate cancer. This idea stemmed from research observing that male smokers taking 50 mg of vitamin E daily seemed to have a lower risk of developing the disease. These initial findings spurred a larger study involving healthy men taking a higher dose of 180 mg of vitamin E daily. Surprisingly, this larger study found the opposite result. Men taking the vitamin E were actually more likely to develop prostate cancer. After reviewing all the research on this topic, scientists have now concluded that vitamin E supplementation likely has no significant effect on prostate cancer risk, despite the earlier conflicting results. 3. Mortality. Another concern some research has raised is the possibility that excessive vitamin E intake could shorten lifespan. However, similar to the findings on stroke and prostate cancer, this area of research has some complexities and uncertainties. One review of several studies suggested that a daily dose of 180 mg of vitamin E increased the risk of death in a majority of the trials. However, this review had some significant limitations. First, the included studies were all quite small. Second, some participants were taking other supplements along with vitamin E, making it difficult to isolate the effects of vitamin E alone. Third, and perhaps most importantly, most participants had pre-existing chronic diseases, which could have significantly influenced their mortality risk. This makes it hard to apply these findings to generally healthy individuals. Another review of multiple studies also pointed towards an increased risk of death with vitamin E supplementation. Across all these studies, the average daily vitamin E dose was around 381 mg. However, there was a huge range in dosages between the different studies. This makes it difficult to pinpoint the specific dose that might be associated with the reported increased mortality risk. If you're taking certain medications, it's especially important to be aware of your vitamin E intake, as interactions can occur. Here are some key medications to watch out for. Blood thinners, especially warfarin. Both warfarin and vitamin E work to reduce blood clotting by affecting vitamin K. Taking them together could significantly elevate the risk of bleeding. Aspirin. Aspirin also interferes with blood clotting by affecting platelets. Combining aspirin with vitamin E can further increase the risk of bleeding. Certain heart medications like propranolol. Vitamin E might hinder your body's absorption of the beta blocker propranolol, potentially making it less effective. There's also some evidence suggesting vitamin E could interact with cholesterol-lowering medications like simvastatin and niacin. Chemotherapy or radiation. Vitamin E may interfere with how well these cancer therapies work, so it's crucial to discuss vitamin E supplementation with your oncologist if you're undergoing these treatments. How much vitamin E do you need in a day? How much vitamin E you need daily depends on your age. Babies and young children require less vitamin E than adults. The recommended daily allowance RDA of vitamin E increases as you get older. Here's a breakdown of the RDA for vitamin E by age group. 0 to 6 months, 4 mg, 7 to 12 months, 5 mg, 1 to 3 years, 6 mg, 4 to 8 years, 7 mg, 9 to 13 years, 11 mg, 14 to 18 years, 15 mg, 18 plus years, 15 mg. The upper limit for vitamin E intake in adults is 1,000 mg per day. However, it's important to remember that some studies have shown negative effects at levels much lower than this. And our bodies don't actually need very high amounts of vitamin E to function properly. Where does most of your vitamin E come from? You primarily get vitamin E from the foods you eat. Many delicious and healthy foods are excellent sources of this important vitamin. Here are some examples of foods high in vitamin E. Vegetable oils, wheat germ oil, safflower oil, and sunflower oil are all great choices. Seeds. Sunflower seeds are a particularly good source. Nuts. Enjoy peanuts, hazelnuts, and almonds for a vitamin E boost. Leafy green vegetables, spinach and kale are packed with vitamin E, along with other essential nutrients. Some foods, like certain cereals and fruit juices, are also fortified with vitamin E. Always check the food label to see how much vitamin E a particular food contains. When you actually need a vitamin E supplement, vitamin E deficiency is uncommon, particularly if you're generally healthy. However, certain health conditions can increase the risk of deficiency by interfering with vitamin E absorption. These conditions often involve problems with fat absorption, which is essential for your body to utilize vitamin E. Examples of conditions that can lead to vitamin E deficiency include Crohn's disease and cystic fibrosis. Also, two rare, inherited conditions called ataxia with vitamin E deficiency and abetalipoproteinemia prevent the body from properly absorbing and using vitamin E. So, how do you know if you're deficient in vitamin E? You might need to supplement if you're not getting enough, and it's causing health problems. Some signs of vitamin E deficiency can include muscle weakness, difficulty walking steadily, loss of sensation in your arms and legs, vision problems, and unusual eye movements. Thinking about taking a vitamin E supplement? It's important to consider the information on dosing we discussed earlier. Here are some additional safety tips for vitamin E supplements. Natural versus synthetic. Supplements can contain natural or synthetic vitamin E. R-alpha-tocopherol is often labeled as D-alpha-tocopherol, while synthetic vitamin E all-recalfotocopherol is labeled as D-L-alpha-tocopherol. The synthetic form is about half as potent as the natural form. Chemical changes. Some supplements are chemically modified to extend their shelf life. You might see terms like alpha-tocopherol acetate and succinate on the label. Your body absorbs and uses these forms similarly to natural vitamin E. High doses. Many supplements contain vitamin E doses that are much higher than the recommended 15 mg. Often, they contain 67 mg or more. Given the potential risks associated with vitamin E supplementation, it's always best to talk to your doctor or healthcare provider before you start taking it. They can help you understand any risks specific to your individual health and needs. The bottom line: vitamin E is important for your health. But, like many things, too much of a good thing can be harmful. If you're otherwise healthy, it's rare for you to need more vitamin E than what you're getting in your diet from foods like nuts, oils, and green veggies. If you're interested in taking vitamin E supplements, be sure that they don't contain excessively high doses of vitamin E. The upper limit of daily vitamin E intake is 1,000 mg, but even doses around 200 mg have been associated with potential harm. The safest thing to do is to talk this over with a healthcare professional who knows your medical history before you take a supplement.